is Justine Shelton, and this is my partner Sherry Morris, and we wanted to share with desk workers today some stretches for the low back. We're part of Yoga Vista Academy. We're both yoga teachers, and I'm a certified Viniyoga Therapist. And I don't know about you, but I have low back pain, and I don't have to sit at a desk all day long. Even just a few hours sometimes can get mine going. So we wanted to share with you a stretch for the Quadratus Lumborum, also known as the QL. It's a deep muscle in the low back that starts at the diaphragm, attaches on the lateral side of the vertebral body, all the way down through the lumbar spine and across the top of the hip bone. And if you look at it in a picture, it looks fairly small, but I've seen it on cadavers and it is big. And when it goes into spasm, or even on the verge of spasm, it can cause a lot of problems. It can elevate your hips so your pelvis gets out of alignment. It can cause compression between the vertebral bodies, getting into nerves and nerve pain, which is no fun. So we're going to do some lateral bends. That is the best way to stretch that muscle. And we're also going to stretch the muscles between the ribs, the intercostals. And those are important to stretch because they help keep our breath free. And I'm one of those people when I get under stress that and quit breathing or just breathe very shallow. So it's really important to keep your intercostals open so your lungs are free and you can continue those deep breaths. So we'll do a lateral bend. Sherry's going to modify for a little bit less mobility. So don't do anything that hurts. Use a modification if you have a lot of tension in your shoulders. We're going to inhale, raise the arms up, and I'm going to grab the opposite wrist with my hand. So taking your left hand, holding onto your wrist, inhale tall, pull your belly in as you exhale, and we're going to tilt to the left. Then inhaling, coming back up. Switch your arms, exhale, abs in to protect your back, tilt to the right. Inhaling to rise, switch your hands, exhale, belly in, tilt to the right. Tilt to the left. Inhale, rise up, switch your arms, exhale, tilt to the right. Inhaling, the breath helps you up. Switch your hands and exhale, we're going to tilt to the side. Now we're going to hold the pose for a few breaths. If this is too much, you can also release that left arm down for support. Maybe place your hand on your head. Each inhale, you're growing taller. Each exhale, really pull your belly in. That's what keeps your back safe. And you might even imagine someone's hand on the side of your rib, breathing like you're trying to breathe into that person's hand. Now wait for an inhale. That breath is going to help you back up. Exhale, abs in. You're going to tilt to the second side. Good. Maybe releasing that arm down for support. Breathing deeply, maybe noticing if there's a difference between each side. The repetition we did brought in circulation. Now we're doing a sustained hold to really stretch the muscle and the fascia. Wait for an inhale. The breath is going to help you up. Exhale, release your arms. And if you have any discomfort in your back, I'm going to invite you to take your legs a little wider, sit up nice and tall, inhale, lengthen, exhale, come into a very gentle forward bend. Then when you're ready to come up, inhale and come up. And now you can get back to work. Thank you.